We have with us Mr. Alex Fair. He's the CEO and president of MedStarter.
I started out as a scientist and got an idea to take evidence-based medicine and help lots of doctors in making healthcare companies and working for healthcare companies for about 17 years now. And so I knew a lot of people who had this problem, who were starting up companies, but get to that point, I almost think of it as like a reef, that your ship gets caught on, or a sandbar, and you need something to lift the tide a little bit. So drive awareness, drive adoption, get some sales. So it does a lot of really cool things, and we can talk about that.
How long has MedStarter actually been in business, if you will?
So almost a year ago was the idea was generated, and we launched the alpha April 27th, and then we launched it for real on the 4th of July.
Are there any other projects that you'd like to talk about, specifically things that you think are really fascinating at this point?
Oh, yeah. I mean, I think that, well, let me talk about Nate's project, because I love that.
Okay.
HIBC is for the Health Innovation Broadcasting Consortium. So it's basically a bunch of people like you and me and Nate and Greg and Pat Salber, who runs actually a competitive site to MedStarter, but we collaborate often. And other people who are very active in the space, bloggers and thinkers, people like, Jane Saracen-Kahn will come on and we'll create some amazing video content together. Guys like Matt Holt come on, and we'll have a channel where we can put it all. And so, we say, I want my HIBC TV, like back in the 80s with I want my MTV. And people wanted it. Nate, what's your viewership like at this point?
I mean, we had several thousand visitors during the course of HIMSS, and definitely several 100,000 viewer minutes.
Right.
So that part of it went well.
I'd like to talk about the whole crowdfunding approach, because, do you have any insights into what projects do well, what projects are just unfundable through this method?
So I think one of the first things you have to appreciate about MedStarter is the audience. The audience is the same kind of people who show up at this chat. It's not necessarily lay people. About 30% of our visitors are CEOs or doctors or high executives in healthcare organizations. People that you just are shocked that they come and they fund a project. Now, these are not people who would be wandering around randomly in Indiegogo or Kickstarter. These are healthcare leaders, and those are the people who really come in and get involved in the projects and become partners with and things like that. So if you can talk to the health crowd and make us care, okay, especially activated patients, people like Regina Holiday, Dave DeBroncard, Hugo Campo, and Paul Sonier. So if you get these guys excited, then they'll talk about it. They'll spread it among their audience. So to get back to your original question of what are the factors that make it work, the most important thing is you have to have something that people really care about, right? So if you have a problem like epilepsy, and you want to fund your local epilepsy center, and you've got a story that you can tell about it that is evocative and will help people understand, how it really affects people's lives, then that's the beginning of a project. And then secondly, you have to have something that is purposeful, right? So something that's going to have an impact. You can't just say, I want to raise money and then randomly put it somewhere. That would be traditional donations, right? Giving to the Komen Foundation or what have you. Here you want to actually say, I want to do this specific project. So those are some of the main things you have to have. You have to have a evocative story, a really great project, some social media or credibility, credentialing presence, and then be on the right platform, which of course is MedStarter.
I was very surprised when I saw MedStarter come out, because the other platforms specifically will not touch anything to do with healthcare.
Well, there's two different things going on, Tim. I'm sorry.
No.
One is they don't allow it because it's complicated and they're worried about changing their brand. So that's Kickstarter doesn't allow healthcare at all. But then other ones do allow it, but it's all DIY. So But now 16 years later, I've been around this block a couple of times. I know how to package up things, and I think our projects are too important to fail. If I see Regina Holiday come in with a pretty good project, but I want it to get to that next level, I'm going to do everything I can to make sure that it gets to that next level. And I've trained my team to be able to help people with this, whether it's making videos or packaging or digital media strategy. We say that it takes an ecosystem to create a healthcare company, not just a village. So you need to be able to reach out to Jeff Tangy, to be able to talk to Aetna for your clients, and to say, hey, did you see this yet? And talk to the right people and sort of facilitate the conversation. So we take it a little further.
Most of the projects need to appeal to patients in some way.
You need to think about the patients. You need to think about the doctors. You need to think about the institutions. You need to think about the big money partners that are entrenched and want to move on to their next version. I mean, Aetna doesn't really want to be an insurance company anymore, right? It wants to be a health IT company, or at least that's what it seems to be the case. Yeah. So they've got their health IT incubator. They bought iTriage and things like that. Well, what if they could go directly and work with the startups when they're just nascent, when they just have an interesting new idea, right? So, but they're not going to want to work with you unless they can see that you've got some traction. I don't know how many of you guys have gone and pitched to VCs, but one of the most common things they'll tell you is, you know what, why don't you go get some more customers, or why don't you go, get some, more revenue, and then come back to us in 3 months or something like that. Meanwhile, you have no marketing budget, and so you have no way to do what you got to do, right? To do what they've asked you to do. So what do? You go and hit the streets, but then you have to do product development and business development, all this kind of stuff all at once. So one of the good things about what you can do with a crowdfunding campaign is if you appeal first to the patients and you create, what I think of as a wave. So it starts way out at sea, and it might just be like a little wave, but then the doctors come in, and those are a little bigger waves. So they'll come in for $100 each, and the first guys will come in for $20 each. Just get the T-shirt, but then maybe the next ones will say, well, I want to be able to give this as an option to my patients. And they become like almost a distributor, right, of an idea. So when you make your project, you're going to actually cover all four of those major players in this scenario, and maybe you'll even think about the insurance company.
Mm-hmm. Thank you.
Scott, I believe did you have a question?
I was wondering if you could shed some light on someone who doesn't know much about crowdsourcing, or in this arena, what our steps would be, just some basic 101 information, and then I might have questions from there.
So, it's been around for a while that people have said, hey, I've got a big problem, let's go solve it, and you get to win an award, for it. But now, with the internet, everybody's all hyper-connected, right? Actually, Indiegogo was the first to really do something well with it. And then Kickstarter brought in what they call the all-or-nothing model, which brought in this momentum where you'd actually be able to say that you're not going to get it unless you get over this certain amount. So she's got 9 days, and she's raised $4,200. And what she's done is she's got a little video here that talks about her breast cancer journey, and then what she wants to do to help somebody else on their breast cancer journey. And the video is a very powerful medium because it really gives you a chance to really, well, just like here, you get to see us talking to each other, real people talking about real things that really matter to them. So they'll tell their story, and they'll show demonstrations of what exactly they want to build. And you can hear their voice. And people can come through, and they can, as the video's going, they can read more about it. They can see who else has backed the project. And then you can say, I want to back something. So I want to get the tote bag. You can see that 6 people have backed this, and 2 people have taken the $50 reward. When you back it, it's no different than any other checkout. We use PayPal. And then once the project's closed, you get an email from the people who actually made the project. Here's your reward. But it's also a great place to get a conversation going where you can have lots of feedback about things. He's got real people wearing his T-shirts already, and kids with Crohn's disease, and people who have been suffering it for 25 years that they want to be part of this, and people who just got it who want to be participants in this kind of thing. So you build a crowd of support around things. Now Michael is being approached by big companies now. This isn't just about raising a little money. He's also raising awareness for this problem. He's developing a brand for himself around it, and he's also, bringing in a little bit of capital. Now, these are not the biggest projects we've had; these are just getting going, but they're interesting. So first, we just check their social presences, but it has to be clinically relevant. And we've had people try to come to us with projects that were dangerous or ineffective, and we have clinical review officers on staff that check to make sure that they make sense. So in the case of your animation project, if it's a patient education animation program, I would want you to make sure that you had great clinicians involved with your project to make sure that your subject matter experts to your content are going to be there. On the other hand, if you're saying we're just going to offer a service to other subject matter experts, that would actually be fine, right? Because there doesn't have to be clinically reviewed. It's just that you want to create a, let's say it's a rapid animation methodology, which honestly we would use. I mean, for our clients, a lot of times the big stumbling block is explaining their idea in a simple, clear way. And as you know, animation is a good way to do that. Just set up your project very easily. You load up a picture. If you have a video already, you just put in a link to the video. You explain your project, and as you're doing it, we give you all sorts of instructions, for each section about how to do each thing. Make it catchy. You can choose one of two funding strategies: keep what you raise, or all or nothing. And you set your deadline. So, setting up a project, if you've already thought about it and made a video, can take as little as 10 minutes. We generally recommend that people, go a little deeper.
Are all projects equal, or do you adopt certain projects and help them along in a particularly advantageous way?
That's a very good question. Not everybody needs as much help as everybody else. And not every project gets, let's just be honest, gets us excited as other projects, right? So you can see projects on our site that we pretty much just let them go up as they were. And we didn't spend a lot of time, writing it for them. So we've got three basic levels that we'll do. Facilitated, which is we give everybody at least coaching and a couple hours of support to try to make sure that their project is as good as it can be. Some people, this is all they need, and they're off to the races and they're great. Others that we think can really be really big projects that can, pay for 20 hours of our time, we'll actually do what we call the partner program, and we'll actually put in enough time to do the videography, to do the rewrites of the project, and just go a little deeper. So we get partnered. And we haven't actually done it yet, but we envision that we'll find a company that we just love so much and is interested in this service that we would give our full time and effort and do what we call an acceleration. So we think that this acts as an accelerator, and is particularly a good way to go about getting partners and all sorts of other great stuff.
I guess I'm asking, how is MedStarter going to make money, or where are you going to get your investment back from that you put into this?
Our revenue model is threefold. We have traditional crowdfunding, which of. We've got challenges. But anyway, so the groups that want to drive innovation faster and better, with the support of the entire ecosystem, using crowdfunding as a tool to figure out which ideas are the best, even a VC. If you want to crowd test before you invest, wouldn't that make a lot of sense? You'll actually see what people want before you put your money, where their mouth is. You don't have to put it just where the mouth is. You put it where the customers are going. So and then our third revenue stream, of course, once it's legal, will probably be equity-based crowdfunding. What we've really been doing is trying to make sure that we have, the best understanding of how healthcare crowdfunding works, and build our audience and with people like yourselves and investors and just people who really care about this stuff, and create a place that they all know that they can go and they can trust that will look for great projects, bring them to you, present them in a good way, and then let you get in early and invest in these companies that you love.
Scott, you said that you had some more questions. Let's go ahead and get some
Sure.
of your other questions answered.
So one of them is the life expectancy or the turnaround time, and by that I mean there's an idea that is hatched today and you're approached. Is this something that is reasonably a 3-month turnaround time, a 6-month, a year and a half? The scale of time in relationship to the projects that you see that are successful.
The general time frame should be fast, and one of the key reasons for that is because it's intense. When you're in the middle of a crowdfunding project, you'll sleep 2-3 hours a night because you're going to have people asking you questions all day long. You're going to be tweeting it out, and getting that kind of traction. You really got to work at it. So 45 days is about right. And about 2 weeks of prep time, we suggest. You also want to get everybody lined up. So you want to call Tim Cook and say, Tim, I want to be on your show. You got to talk to, Lisa Fields, Practical Wisdom, and say, I want to be part of Healthcare Leader next week. So you want to line up all of your sort of media. You want to see if you can get into a local TED event or a local Health 2.0 event where you can talk to 100 people at once about your thing and say, by the way, I've got this project. It's great, and it also happens to be on MedStarter. So there's a whole launch strategy that takes a week or two to sort of pull together.
Those two different ways where I'm want to help the doctor here at Wake Forest, him do it with the doctor's perspective and me with the patient's perspective.
Some of the best videos, are group projects, but I don't think I've seen one where you had a patient advocate leader, then have the physician advocate leader, or the early adopter physician, in the same video. So I think that's a cool idea. I would love to see that and help you make it happen.
We're just about out of time. Do we have any more quick questions?
I am a researcher, so of course we need to get funding for research, but MedStarter is not for funding research. And so that's why I was just the associate producer.
You don't necessarily look at the platform as the end. It's really just the means. You could ostensibly fund research with a crowdfunded model. It's just understanding how to be creative with the incentives that you're providing. Perspective. There's no reason why you can't go out and get funding from multiple different sources, run it through a crowdfund, and you essentially use the crowdfund as sort of the place where you're pooling all the funds, but use those big donors as sort of fodder to bring in the small donors to show that there is, there's traction, that there's interest, that there's some validation. At the end of the day, there's always someone who has an incentive or who wants to support your project, or hopefully there is, right? It's just all in how you frame it and cast it out to that audience. So I wouldn't necessarily discount crowdfunding as being inappropriate for funding research.
When a stadium full of people watch your video, and if you're passionate about what you're doing and it makes sense to people, if you can explain it, interesting things happen. And it's not always the money. Captricity raised $1.6 million off the site, but they raised $10 on the site. Why? Because it wasn't anything anybody wanted to buy. But the Knight Foundation and 4,000 other people watched the video, and 6 weeks later, they got a term sheet.
Excellent.
This company had this photoshopped little prototype for a contact lens cleaner, and after 4 days and 996 views, Bausch & Lomb bought them. Okay, it was 3 graduate students, in Stanford.
Right.
So you make a great video, you explain it to people, the sky's the limit. You can, all sorts of interesting things happen. And a story will come out in USA Today or something.
Excellent. Well, again, thank you all so much. I want to thank the panel. It was a great interactive panel, and I hope you guys come back. Remember, we're here every week on Thursday sometime during the day. Thank you all so much.